Well, the good news is that it appears COVID cases appear to be leveling off statewide as compared to numbers we saw about a month ago. But state health officials say those numbers don't tell the whole story.
This month marks the third summer of living with COVID-19.
On Friday, Oregon health officials gave a snapshot of the status of COVID-19 in the state. Positive tests and cases were slightly up. Health officials believe cases may be leveling off. Still, there are concerns.
We assume these numbers are a dramatic undercount of the actual number of cases because we know many people are using at-home tests and not reporting the results. We also know many others are not getting tested.
State epidemiologist Dr. Dean Seidlinger says data shows the number of hospitalizations have remained relatively steady and should not overwhelm the hospital system's ability to care for patients.
That's not to say that hospitals and healthcare is not strained, as we are 2.5 years into this pandemic. The good news is that far fewer people are getting seriously ill with COVID-19 now than during previous surges.
Of course, the big update this week, the U.S. Food and Drug Administration's recommendation to approve the Pfizer and Moderna vaccines for kids 6 months to 4 years old. Full approval may come as soon as Monday.
This is the last group of residents who have not been able to receive the protection provided by vaccine. It's a big group, too. In Oregon, the population of children ages 6 months to 5 years is about 230,000.
Doctors say this is an important development since we're not out of the pandemic just yet. Here's Dr. Don Knowles, professor of pediatrics and infectious diseases at OHSU.
It's really amazing in such a high-income country as ourselves that an infection, COVID-19, is now in the top 10 causes of death in children under 5. And that, to me, is just heartbreaking.
Now, looking ahead, a question did come up during the press conference about Oregon 22, the World Athletics Championships that are set to start in Eugene next month. It's going to be drawing hundreds of athletes from around the world, and it doesn't appear that state health officials have a specific prevention plan for COVID in place, although they said that they do plan to monitor transmission rates through wastewater, and also said that because events will be largely held outdoors, that should also be reducing transmission rates. Although at this point it does appear that individuals will be the ones who will be in charge of making safe and healthy decisions, especially if they notice symptoms. Christine Pitawanich, KGW News.